Good, guys. So, pleasant good morning. Yours truly, Dr. Jason Batson-Sougrin, the Senior Medical Director at Batson and Associates, where we support your health naturally. So, yesterday afternoon, we had our usual discussion on Synergy TV. That's with Mr. Happy Boris. That program is usually aired every Thursday from about 5:05 to like about 5:25. Right, so we had that yesterday, and as usual, we would have our Sunday night program. That's the question and answer, where we will entertain various questions and that type of thing. So a lot of content. Feel free to follow us on our social media. Remember, we are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT, and on YouTube, we are Batson and Associates. So what we're going to talk about this morning? Well, I'm going to give you guys a brief program this morning, based on popular demand, and we're actually going to be discussing hormonal imbalance in women. Now, you all would realize that I speak about this a lot, and the reason why I do, quite frankly, is because we have a lot of women going through this. The thing is, we have a lot of young women going through this because you have school-age girls who have serious issues associated with hormonal imbalance, issues associated with things like polycystic ovarian syndrome, issues associated, yeah, good, issues associated with a number of problems, painful menstrual cycle, irregular menstrual cycle, even issues associated with the conditions of being able to function. A lot of women who have issues with serious hormonal imbalance challenges have issues with the employers, because a lot of times you will have to take sick leave because of the situation as it relates to being able to function when your menstrual cycle is very painful, because no one likes pain. And if you are painful, or you are having a painful menstrual cycle, rather, you find you're going to be in a situation where you're going to have to miss days because of the nature of the situation. There are some women who have bleeding for excessive number of days. So a female could have a cycle where she may supposed to or accustomed having a 7-day period, and now she goes more than 7 days. So she could actually have a situation where she's spotting or has severe bleeding for 15 days. Think of the inconvenience of something like that. But of course, we're not only focusing on the inconvenience, but we're actually focusing on the health situation as it relates to what that is saying about your body. Now, I often tell persons that your body speaks to you, but most of the time we don't listen. We don't understand how to listen. So maybe you need an interpreter. And primarily that is what doctors are, or that is what doctors are supposed to be, being able to translate what your body is telling you based on the symptomology as regards to what is happening. And I always tell persons that is how it's supposed to be. Now, keep in mind our open clinic days. We do have our open clinic day, today as well as tomorrow. So those of you in the West area, those of you in like places like Diego Martin and environ, St. James, that type of thing, I would actually have an open clinic day today in St. James. That's going to be taking place from about 11 a.m. And we also have one tomorrow, please God, as well. An open clinic day simply means not that the clinic is free, however, but that you do not necessarily have to have an appointment. We know the year is coming to a close. A lot of individuals have issues that maybe have been troubling you for a number of years or months, weeks. And you want to get it out of the way because, of course, we know the year, as I said, is closing. And we have a new year approaching, and we usually have that salutation that we give each other. Have a bright and prosperous new year. Now, your new year could only be bright and prosperous if you are healthy. Right? You have to be healthy in order to have a bright and prosperous new year. You don't agree with me? If you're sick, if your blood sugar levels continue to remain elevated, so you having 400 and 500 and, well, error in some instances because some machines only go up so high, and you have issues where your blood sugar is significantly high, even though you are on insulin, Going into the new year, if that continues, it means that your eyesight is going to get worse. It means your mobility, is going to get worse. It also means that your likelihood of having an amputation has significantly increased because of that consistent elevated blood sugar going into 2025. You don't want that. So that is even more good reason to give Batson and Associates a check before the year is finished. We have those open clinic days, as I mentioned. The telephone numbers, the one that I have below there is the one for the Tobago office. Tobago, you'll be seeing us, God's willing, in January. We'll let you know exactly when in January. You could, of course, call those telephone numbers that are below there, and they would be able to give you the dates and times and whatever the case may be, where you could actually book your appointment for that Tobago branch, which is in the Triangle building in Scarborough, Tobago there. Now, as it relates to Trinidad, as I was saying, St. James, which is Red Edge Mall, Western Main Road, St. James, and we would have that clinic today and tomorrow, please God, so you can avail yourself of that. The telephone number that you're going to call is 222-8261. I'm going to put that up for you. Good. So that number there is 222-8261, 222-8261, as well as 314-9975. So if you know you have some time today, you may be after work, because we do carry that location to a certain number of hours before we close. So you can, maybe if you're after work, you want a consultation, you can feel free to give us a call, give us a visit. As I say, we have a walk-in clinic today. We also have one tomorrow, please God, as well. And that simply means you do not necessarily have to have an appointment. What I do suggest you do, if you're coming for the consultation, which is basically us going through some information with you, we're going to fill out some forms for us, we're going to evaluate you to a certain extent, and then of course we can make recommendations at that point in time. If you walk around with, or walk, with like your abdominal pelvic ultrasounds, if you walk with your blood tests, whatever the situation that you are experiencing, that of course gives us better opportunity to really be able to do specific recommendations. We do offer and still offer the live and dry blood analysis, which is a strong point in my opinion as a practitioner of integrative medicine. People often ask, what is my specialization? I have a few. Primarily internal medicine, primarily integrative medicine. And internal medicine is where you have the ability to be able to understand certain dynamics taking place in the body from a biochemical perspective, from a inflammatory perspective, from an oxidative perspective, in terms of biochemistry and how the body functions, and determine a proper treatment protocol to correct that situation. Now, you have Western doctors that are actually internal medical specialists. Their approach may be different from mine, or naturopaths, people who are trained in integrative complementary medicine, alternative medicine, and that is no problem. But the end result is always what you have to look at. So if you are a diabetic and you have been a diabetic for years, the question arises, why do you have diabetes for years? Is it that the diabetes cannot be reversed? Is it that you're not doing the correct things? Is it that you're not paying attention to where the problem actually originated in the first place? And by not doing that, as Albert Einstein said, the only people who do the same thing over and over, expecting a different results, is fundamentally what? Mad people. That is the height of insanity, as he described it. So the thing is, you cannot continue doing what you're doing all the time. So those of you who may have problems, it doesn't matter what the issue is. Once you're a human being, I do not have any training in veterinary medicine. So as I said, once you're a human being, I'm quite sure that we could render some assistance, even from a nutritional perspective, because Batson Associates are complementary medical and integrative nutritional consultants. And what that means is that we have the ability to design treatment protocols which would now be designed to deal with a specific aspect of ill health or a disease in the body. I was mentioning dry blood analysis and blood. There's a reason why blood is the most tested serum in medicine, and I always say this over and over. And the reason for that is because blood touches every single part of the body. Every part of the body, blood comes into contact with. Now, that's very important. You know why? Blood has the ability to be the most, where's the word I want to use, boy? We'll say, like we say in colloquial language, it is the most macocious agent in the human body, because blood has the ability to pull information just based on touch interaction. A lot of people, so that is why they look at antigens. For example, if you have a prostate problem, they look at something known as your prostatic specific antigens. What are antigens? Antigens essentially are messengers in the blood that now looks at, so they're able to tell you your PSA. There's something known as your ESR, which stands for erythrocyte sedimentation ratio. So that's what blood is telling us there is the level of inflammation in the body based on that erythrocyte sedimentation ratio. So they actually have a way to determine that from a quantitative perspective rather. So it means that blood gives information, and in a dry blood analysis, in a live blood analysis, someone who is trained, like the consultants that work at Batson Associates, and myself being the senior consultant, we have the ability to understand and interpret that data and translate it now for you and give you practical suggestions, implementable suggestions that could now give you a positive change. We have had persons who came to us who use less insulin, who have, or in some cases none again, who have improved their blood circulation and their diabetic neuropathy situation, so they no longer have things like pins and needles, cramping in their cars, burning on their feet. They don't have those things again because of the protocol that Batson Associates give them. So it's a matter of being able to understand where you are, most importantly, where you want to be, and what you need to do, what you need to use. Are you drinking sufficient amounts of water? That's a big, people start to call me the water doctor now, because I always behave terribly with people who do not drink water, because I find it so almost to the point of illiteracy. Again, not attempting to be facetious, condescending, or rude, but it's almost even to a point of stupidity. Because you have to understand that that is a decision that you don't really have, well, you shouldn't really have much say in it, simply because it is an inert, for want of a better expression, it is a natural aspect of the body. It is a rule. There's a rule for drinking water, and the reason why there is a rule is because your body has a specific requirement of water that it requires on a daily basis. And that requirement changes sometimes depending on your occupation. So if you're a mason or someone who works outside, a gardener, landscape, or whatever the case may be, you're in the sun. You're going to have on long sleeve clothes, so it means you're going to sweat a lot. You're going to be losing fluid. So it means your water intake is now increased based on your occupation. This thing is simple. It's just a matter of using some common sense, you know. I'm not saying that we're not using common sense, but just have to think about it. So in a situation like that, when you decide not to drink water, you're essentially killing yourselves. Hence the reason why I use the word stupidity, because that has to be stupid. If you take care of plants or you do gardening, and you do not have the resources, or you do not have the mobility, or you do not have the finances, for want of a better expression, or in those cases rather, to hydrate your garden and you know, set up systems of hydration for your garden, eventually the crop's going to die, right? So regardless of your circumstance, regardless of how you feel because of your circumstance, the crops need to be watered. Plants need to get wet. So the body is the same, regardless of whether you don't like water, whether you have access to water, whether you're drinking pipe water, you're drinking the wrong water, or whatever the case may be. That is irrelevant. The point is your body is 70% water, and in order for any function, listen carefully to what I'm saying, any function, biological, chemical, whatever the function is in the body, hormones, muscles, whatever that function, even bowel movement. And I always tell people that if you want to kill yourself and get very sick, don't drink water, and you'll be very successful. Because when you are dehydrated, what's the meaning of dehydration? Dehydrated, right? Not enough water, not enough hydration, right? So if you are dehydrated, you know what your body does? Your body goes into panic mode. And when it goes into panic mode, what it does, it starts to take water from your intestines, start to take water from your muscles, and then it starts to take water from your stool. So it literally absorbs the water from fecal matter because it is now in an emergency stage. And that's why most people who are not properly hydrated end up constipated. Now, there are a number of different factors that contribute to constipation outside of not being properly hydrated. A lot. Right? So, of course, feel free to join us. Keep in mind those open clinic days. Those of you in South, that's Debe, that office located at the corner of Ramsonwood Trace and the SS Erin Main Road in Debe. The open clinic day for that office is next Friday. Well, we actually have Monday. Let me just take my phone here so I can make sure I give you the dates and not be guessing dates as regards to that. Now, as it relates to the Shaguanas Clinic, of course, as it relates to the Shaguanas Clinic, that open clinic day, of course, is, as I said, that's going to be on the 18th, right? That is the 17th. No, that is the 18th, Wednesday the 18th. And of course, Debe is going to be Friday the 20th and the 21st. St. James is today and tomorrow, and they would get a next Friday as well, which would be that Friday of the 20th as well in the St. James office. So wherever you're located and you want us to fit you in, as I said before the year is out, because this is based by popular demand, a lot of clients actually made some requests of us to really, give them the opportunity to look at themselves. Some people prefer to wait till next year, and we don't have any problem with that, because you must know your budget and your finances. You can't send anybody to steal, right? However, so if you want to do that for the new year as well, we could understand that. However, if it is you can't do it now so that you start the new year. You basically get a head start, essentially. And especially if you're dealing with current issues, if you may be a stroke patient. We have a lot of stroke patients that we deal with. We do nutritional protocols for anything. If you have a surgery, if you would have done surgery, we also do dietary protocols for that as well, because if you're not aware, there are things that we could recommend. There are protocols that we could put together to actually help the body to heal faster than usual, help the body to reduce inflammatory response. We also do work for cancer patients, and I respect anyone who has cancer. I respect their decision. In some cases, I may not necessarily agree with the decision, but you are, at the end of the day, I work technically for you, right? So it is my job to advise you accordingly as it relates to my expertise, my experience, and of course what I determine practical for your treatment protocol. What I always tell persons with cancer, and this is me as being as genuine as I can be, truly genuine, is that when you are diagnosed with cancer, and understand one thing and one thing only: you are in a serious fight. Serious fight. This is not a joke fight. Cancer is not a joke disease, which is why when I deal with cancer patients, I always dot my I's and cross my T's, meaning that I want them to understand from a mental and a psychological, and emotional perspective that this is a battle, this is a fight. And like with all fights and all battles, you need to mentally, psychologically, spiritually, all the ollies, prepare yourself, right? And whatever decision you make is up to you, and will always be up to you, because you have to live with the consequences of your action. And if you do decide to do chemotherapy and radiation, which is your right, I believe in being informed in whatever decision you make. I want you to be comfortable with that decision, because based on different type of cancers, I am not one of those naturopaths that will tell you do not completely do. You have to take certain things into consideration. And as I said, at the end of the day, that decision, excuse me, is fundamentally yours. What I would advise you to do is we would put together a treatment protocol from a nutritional perspective that would not interfere with your treatment protocol. But what it would do, it will give your body a fighting chance. And that's what a lot of people don't understand with cancer. There's a reason why I always say I'm not in the politics of medicine, because I am not, and I have no intentions of becoming that, right? But what I am is very practical and experienced. And I can tell you, of all the cancer patients that I have met, that I have interacted with, they have immune and compromised microbiome. They always have compromised gut. Some cases, leaky gut syndrome rather, in some cases, serious inflammatory bowel conditions. And those contribute and create an environment that is conducive for cancer's survival. So if you do not correct that environment, if you do not strengthen your system, if you do not build your immune system, you are fighting a losing battle. End of discussion. End of discussion. Because you have to give yourself, cancer is not a regular disease. I always tell people that. It, quite frankly, is a very expensive disease to treat, even in an integrative setting, compared to other issues. So if you get somebody with diabetes, a diabetic protocol, in some cases, if you are really terrible diabetic and you have really bad circulation, your neuropathy, because you see, the thing is, as doctors, regardless of the type of doctor you are, once you're a good doctor and you understand anatomy and physiology, which I comprehensively understand, you would realize that when your nerves are damaged, when you are suffering from neuropathy, your body is in a state of disrepair. It is in a state of, what's the term I want to use? The old people are saying, or the Bible even talk about the beginning of pangs of distress. You know what that means? It means your body is in an emergency state. Your body is fighting to save you, you know. So what you have to understand is that you have to give your body the best opportunity from a spiritual, supramental, mental, vital, or energy, as well as a physical perspective. So if you don't do that, you don't believe in meditation, you don't believe in saying your prayers to whoever you pray to, that's your business. But it is an exchange, it's energy, it's vibration, it's frequency. So if you can't do that, and you're not doing that, then you're not going to win. You're not going to win. So if you know somebody who has cancer and they're serious and they want a protocol to help them, because you need help, you would realize, if you look at cancer treatments of America, and you look at integrative cancer centers, they have better results as opposed to the ones that do only conventional or allopathic medicine, and even the ones who only do natural therapy, because you need some aspect of Western medical science inside of there. So it's a give and take situation. And a lot of people don't understand that. So that is where we help you to understand. That's where we help to correct certain things and let you know, listen to me, this is what you need to do. These are the changes that you need to make. And when you do that, you actually have the ability, as I said, to now have a better fighting chance. A lot of people don't give themselves fighting chances when they are sick, because you're not servicing the body. Look at Santulan. Santulan is a 7-channel detox product that we carry. Santulan cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Your body has 7 channels or 7 drains, for want of a better expression, in which it allows waste to be removed from the system. Your lymphatic system being one of the most important, but you know how many people, and that's the next thing. Do you know that your lymphatic system functions better or can only function effectively and efficiently when you are properly hydrated? So water comes into the discussion again. So understand that it is very foolish, it is very stupid, plain talk, bad manners, to not properly hydrate yourself. You are killing yourself. In some cases slowly, in some cases very quickly. So remember the rule for drinking water, your body weight divided by 2 in ounces. Note there are circumstances where you may have to reduce your water intake, maybe in the beginning, and we work with you. Those are people who are renal patients. If you are somebody who dialyzes, you know your situation with water. And a lot of people who end up on dialysis ended up there because they didn't used to drink water. So you reach a stage now. I often tell people that a lot of us do not pay attention to our health until our health is taken from us. So it's when you have cancer, then you want to drink all the soursop leaf in the world. You're ready to kill all the soursop tree and drink it. Why you didn't drink it before? An ounce of prevention is better than a pound of cure. Better, way better. My great-grandmother taught me that. There's a reason why people say an ounce of prevention is better than a pound of cure. 16 ounces is a pound, right? But they tell you if you use 1 pound, 1/16 of the whole pound in prevention, it will prevent you from having a whole pound of problems. 16 times the amount as it relates to the preventative methods. And the same applies with integrative medicine. I always tell people that people don't talk about expensive. And that's why I coined that saying, if you think health is expensive, try sickness. You know why? Because if you have good health, there isn't anything you cannot accomplish. Anything. You know why? You have the will, you have the drive, that physical body. Because the thing is, you could mentally want to do something, you know, but physically your body saying, hey, you could be watching a flight of stairs or watching the Queen's Park Savannah and saying in your delusional mind, because some people just be delusional at times, all of us sometimes we be a little delusional, but you're delusional watching there and saying, hey, I'll tell you why you're delusional. Because your mind saying, I could run that Queen's Park Savannah, you know, but your body saying, with your painful knees, with your 50 pounds overweight self, with your low energy, hypertensive self, that you cannot do that. So what you have to do now is fix everything in sync. You have to balance the spiritual, the supramental, the mental, the vital, the physical body. And when you do that now, then you could make the corrections. So check out those dates. Keep in mind, Debe, that's Saturday, the 21st of December. That is at the Debe office. You can give a call. We do have open clinic day. We have appointments available still for that clinic. That telephone number you can call, of course, for that Debe office. Debe telephone number is 223. That's 223-7515. Again, Debe is 223-7515. And of course, you can call Shogunas, which is 222-8261. That's 222-8261. And the WhatsApp is 314-9975. Again, that WhatsApp is 314-9975. You're listening to Dr. Jason Batson-Sougrin, the Senior Medical Director at Batson and Associates, an organization of trained consultants in what is known as natural and integrated medicine. And you know, the thing is this, you may be sick and nobody could tell you why you're sick. We get cases. I like cases like that. Yeah, you're sick, you're dying, you can't sleep, your head hurting you, they tell you you have PMS, they tell you you have lupus, they ain't sure if it's connective tissue disorder, they tell you you have an autoimmune. Good, that's no problem. We could fix that. I could tell you what you have. And I could tell you how to fix it, but you have to understand that you have to do the work. I can run for you, I can exercise for you, I can eat properly for you, but I could guide you. You know the old people ever saying, you could take a horse to water, but you cannot make them drink. I was in Tobago recently, and I love Tobago. You know, so quiet. And a lot of clients there as well. You know, hypertension, a big thing in Tobago, prostate. And we deal with that, and we have successfully helped so many persons. Let me say a pleasant good morning to one of our very good clients over there who got really, really excellent results with her blood pressure. She used to average her blood pressure of anywhere between 195 to 120, systolic, and diastolic 120. Listen to me, that is stroke pressure. Blood vessels are rupturing in your head simultaneously when you're testing pressure and your pressure reading like that. They are stretching and opening in situations where they could give you things like a brain aneurysm and all those types of foolishness. So it's essentially important that you look at your circulation, and our magnetic resonance analysis scan does that. We could tell you how much blood circulation, the percentage of the total that is actually reaching your brain. So when you have glaucoma, don't think glaucoma is just high ocular pressure. Glaucoma is a clear indicator that you have poor cerebral blood vessel circulation. Layman terms, you're not getting enough blood and oxygen beyond your neck. So after here, going up here, you're not getting sufficient blood and oxygen. Do you know how detrimental that is? If you leave that there, you will end up with a stroke. God forbid, you can, let me say can end up, let me just say will. But in some instances, they will, because I have seen cases or had cases where we have examined persons and made recommendations and they just didn't take us on. I don't know why you come to me and you wouldn't take me on. That doesn't make any sense. Don't waste your time. Don't waste my time and don't waste your money. That don't make any sense. I believe in if you're seeking a second opinion and you get our opinion and you do agree with it, okay, fine, no problem. I'm not saying no. But what I'm saying, the practicality of it, you have to look. Depression, anxiety. Why do people get depressed? You think they just get depressed just so? You just get up there and, oh God, I suffer from depression. And I'm not saying it in that way to offend anybody, right? So what you'll say, depression runs in your family. So because your grandmother was depressed and your great-grandmother was depressed, or she had diabetes and your uncle had diabetes and the dog have diabetes and the plant and the step have diabetes now, you're supposed to get diabetes. So because of that, you're licorice and greedy and just eating everything inside because, oh, I born from a family or I come from a family that have diabetes. That's nonsense. Genetic load the gun, lifestyle pull the trigger. So you could come from a family that predisposed to what? If you take care of yourself, if you balance those 5 elements of the body, spiritual, supramental, mental, vital, physical, then you could comfortably say that that curse has left you. I come from a family that has diabetics, that have hypertensive people, that have obese people, but all of them do some foolishness to put them in that situation in the first place, and foolishness that I wouldn't continue. So regardless, even though you get, remember, a sperm and an egg contributed by a man and a woman is what gives you a child, you know, right? Because that fusion is what creates life. So if you have a bad sperm and a bad egg, it's obviously you're going to get some of the bad that was in the sperm and some of the bad that was in the egg. But you are now one unit, and that unit has the ability to do so many things based on what you now put and ingest into the body. So if you're born halfway, and you're going eating foolishness, you'll continue being halfway until you die. So you come from a family, obese, everybody big and obese, and you just continue to be licorice and use a lot of sugar and eat everything inside. What do you think going to happen? The opposite? No. Genetic load the gun, lifestyle pull the trigger. So with that being said, keep in mind those dates. Remember today, those of you at the St. James office, that is Red Edge Mall, Western Main Road, St. James. We do have some spaces today that we can take. Those like all after 4, after 5, depending on your situation. As I said, you may be someone who's working, you're very busy, you always wanted to come to Batson and Associates. You can also look at tomorrow as well. I know we have some spaces tomorrow, please God, as well, for that open clinic day. And as I said, we do take walk-ins. Good? If you have intentions of coming, you can come, do your consultation, at least get your information. What you could also take advantage of is at least you have your consultation. So even if it is your plan to just take 1 or 2 things like the Santulan, which I always recommend, and maybe 3 bottles of the Alkagen water, so that during your Christmas season, when you go and take a little drink here, you take some pastel here, eat a little black cake here, which I love black cake. And for Christmas, you could partake of things, but moderation. I was doing a program yesterday on Tobago Channel 5, not yesterday, day before yesterday, which is Wednesday morning. I normally do a program on Channel 5, that's for Tobago. And I was discussing the importance of moderation and really understanding that, yes, you could partake of the little ham, the little, whatever the case may be, your punchakra and whatever, but moderation. You can't be a diabetic and hypertensive and want to sit down and eat the whole ham. Then your blood pressure will reach 500 and something. I just saying it won't reach that high. But it's going to reach ridiculous numbers and it can give you strokes and it can cause serious issues in the body. So don't do yourself that. Pass by Batson and Associates, get a Santulan, Alkagen water, and you can maintain a level of cleansing throughout the holidays. And listen to me, with Santulan, you could use Santulan and go partying and go New Year's party and all kind of thing. You know, don't feel when you drink Santulan, you're living in the washroom and you can't go anywhere, you know. Product don't work so. Very effective product. It's one of our #1 products, and that is with all our clients. Caribbean, regional, international. Really good product. Is a 7-channel detox, cleans and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. My Facebook family, let me say before I exit that I have not forgotten you guys. It's just a lot of work, you know, and of course, our other social media platforms. So you can follow us on TikTok. On TikTok, we are Batson and Associates. On Facebook, we are Batson and Associates Limited. On Instagram, we are Batson Associates TT, and on YouTube, we are Batson Associates Trinidad. So follow us. Remember those open clinic days. And of course, we're actually doing an additional clinic day. We're going to have it post up for our international clients, because we actually had, by popular demand, some of our international clients who will actually be coming to Trinidad for the holidays, and they wanted to know if they can get an appointment. So we're actually working on that. And of course, we're actually going to do one for our international in terms of like Zoom consultations and WhatsApp consultation, WhatsApp calls, whatever the case may be, to deal with those international individuals. So again, keep in mind those telephone numbers and locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. That telephone number again is below there, 222-8261. That's 222-8261. Debe is, of course, the corner of Ramsey Trace and the SS Erin Main Road in Debe. That telephone number for Debe, again, you can call for Debe 223-7515. So that's 223-7515. Debe's open clinic days, Fridays, 2 days rather, is Friday the 20th and Saturday the 21st of this month. So you can take advantage of that. St. James is today and tomorrow, please God. That's Red Edge Mall, Western Main Road, St. James. Tobago, you're going to have to call. That is going to be in January, God's willing. They could always take your information and we'll get back to you once we have confirmed. Well, we have confirmed certain things, but in terms of scheduling the amounts, because we usually have a lot of clients for when we do, depending on how we deal with Tobago, that type of thing. And of course, those dates are adjusted accordingly. Keep in mind too, as well, that office in Debe, corner of Ramsey Trace and the SS Erin Main Road. And Chaguanas is first floor Money Talks building in Montrose, Chaguanas. You have been listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. Remember to check out our products, the Santulan, that 7-channel detox, that cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin and your lungs. Nerve Restore, really good product, excellent. One of my favorites. If you have a very high demanding job, if you feel that you do not sleep properly or you need to improve your sleep, you may have a little problem with depression, anxiety, you lack energy, you lack enthusiasm. When you get up in the morning, it's like, oh God, you're only hitting that snooze button. Like, you know, you hit the snooze button like 50 times. Well, it wouldn't, not 50, because then you wouldn't go to work. But it depends on how your snooze is. But in any case, the point is low energy, tired. Men, prostate, we do not have to touch you to do an evaluation. Very important. Find out what's going on. Because listen to me, when you reach the point where you cannot urinate, men, and they have to put that device called a catheter inside of your private part, you will understand and you will beg and wish that you had taken better care of yourself. So don't be a beggar and a wisher, right? Take care of yourself, check yourself, because anything that is of value, remember this, requires preventative maintenance. So if you value you, then you need to do what? You need to maintain you. So check us out again, Batson and Associates Limited on Facebook, on Instagram, we are Batson and Associates. On YouTube, we are Batson and Associates Trinidad, and on Facebook, we are Batson and Associates Limited. Remember those telephone numbers again and locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. That telephone number again is 222-8261. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. That number for Debe again is 223. I just can't remember all these numbers. There's a lot. 223-7515 or 341-4813. Debe again, remember the 20th and the 21st of December. That number again, 223-7515. That's 223-7515 or 314. That's 314-4813. So again, you have been listening to Dr. Jason Batson-Sougrin, the Senior Medical Director at Batson and Associates, where we support your health naturally. So whether you're dealing with diabetes, hypertension, ulcerative colitis, Crohn's disease, some sort of neurological problem, myasthenia gravis, issues associated with eye problems. You know, we have some really good products for eyes. And we're waiting on some stuff. So, you know, we have some stuff to get for you guys, but we're going to get it. And check out that circulation regeneration tea. Really good for hypertensive individuals. Those of you who may have pins and needles cramping in your cars, burning under your feet. So check us out again. And remember, as we always say at Batson and Associates, If you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless. Be safe out there, safe on the roads. Remember, we might get some rain today. The place is wet. Take your time and drive. God bless. And till next time.